What does it truly cost to care? Journey with us into the lives of psychiatric nurses. Good day, everyone. Today, we will be presenting our study entitled The Lived Experiences of Nurses in Psychiatric Care. I am Shayne the ESTOQUIA, and together with me is DANICA Cordova, ERICKA Angela Dormido, and Josh EDEMNI.
For the background of the study, psychiatric nursing is a specialized field marked by unique challenges, yet while most research has centered on patient outcomes, the lived experiences of psychiatric nurses remain underexplored despite their critical caregiving role. In the Philippines, where the Mental Health Act of 2018, Republic Act 11036, has emphasized the need for comprehensive mental health care, psychiatric nurses continue to face increasing demands amid limited resources, inadequate staffing, and scarce professional development opportunities.
For the objective, the study is aimed to explore the lived experiences of nurses in psychiatric care.
With the significance of the study, the research may greatly benefit the following Department of Health personnel and psychiatric nurses.
And now for the theoretical framework of the study. First, we have Joy Travelby's human-to-human relationship model, where it highlights the interpersonal aspect of nursing and the importance of meaningful nurse-patient relationships in providing holistic care. Next is Jean Watson's theory of human caring, where caring is central to nursing practice and promotes health more effectively than mere medical interventions. And now for the conceptual framework, which is anchored on Joy Travelby's human-to-human relationship model and Jean Watson's theory of human caring, followed by the profile of the nurses according to age, sex, and years of experience, and the thematic presentation of lived experience of nurses in psychiatric care. And for the methodology, the study follows a qualitative phenomenological research design and uses semi-structured interviews as a data-gathering method, with 8 registered nurses in psychiatric care as participants, and it uses a purposive sampling method.
Now, for the results and discussion, this section presents the key findings of the study. Starting with demographics, the participants in this study were nurses in psychiatric care facilities in Negros Occidental, aged 31 to 43, with 2 to 15 years of experience, most having at least 5 years. This diversity in age, gender, and professional experience suggests a range of perspectives and levels of expertise in psychiatric nursing. And now for the theme 1, Nature of Psychiatric Nursing Work. For this theme, it explores the unique and demanding nature of psychiatric nursing, highlighting the emotional and behavioral challenges, unpredictability and safety concerns, and the importance of therapeutic communication. Nurses share the emotional toll of handling aggressive or distressed patients, the constant need for vigilance to ensure safety, and the key role of communication in building trust and supporting recovery. These findings align with studies showing high rates of workplace violence and emphasize how effective communication helps manage challenging behaviors and support holistic care. And now for the theme 2, Professional Fulfillment and Satisfaction. This theme presents the participants' experiences in achieving professional fulfillment and satisfaction while working in psychiatric care, with the sub-themes: first is emotional rewards and patient progress, second, sense of purpose and impact, and lastly, job satisfaction and career commitment. Despite the challenges, many nurses feel satisfied and motivated by the progress they witness in the people they care for. This emotional connection strengthens their resilience and reinforces their dedication to mental health care. As one participant shared, I can say 100% satisfied with what I'm doing. Regardless of what I'm gaining from the job itself, the fulfillment you get from doing what you like and seeing the results shown by the people that you help. Now for the theme 3, focuses on coping strategies for work-related stress. Psychiatric nurses face constant emotional and psychological pressure, so developing healthy coping mechanisms is essential. This theme includes 4 sub-themes. First, work-life balance, physical activities and relaxation, support from family and colleagues, and mindfulness and self-awareness. Nurses share that setting boundaries, even between work and home, helps them recharge and avoid burnout. They also find relief through exercise, rest, and spending time with loved ones. Support from colleagues and family plays a crucial role in maintaining emotional stability. Finally, mindfulness practices like reflection and self-awareness help them stay grounded and resilient. One participant expressed, "I prioritized work-life balance so I can return to work with a fresh mindset." These coping strategies help psychiatric nurses sustain their compassion and effectiveness in the face of daily challenges. And now for Theme 4, it highlights the importance of support systems and resources in helping psychiatric nurses cope with the emotional demands of psychiatric nursing. It has 4 sub-themes. First is team and colleague support, second, family support, and then next is government and institutional support. Lastly is mental health resources for nurses. Nurses shared how peer support from colleagues gives emotional strength and prevents burnout, while family serves as a vital source of comfort and stability. They also stressed the need for better staffing and institutional support to reduce workload stress. Also, many emphasize that although they care for others, their own mental health is often overlooked, calling for accessible mental health services tailored for nurses. One participant said, "Sometimes we don't get any chance to manage our stress," while another added, "Talking to other nurses provides comfort and reassurance." These support systems are essential for sustaining resilience, compassion, and professional excellence in psychiatric nursing. Lastly, Theme 5 explores how psychiatric nurses face and overcome stigma and misconceptions related to mental health care. These sub-themes include first, stigma from society, second, personal experience with stigma, and lastly, changing public perception. Participants shared how society often misjudges both psychiatric patients and those who care for them, leading to emotional strain and professional devaluation. Despite these challenges, nurses are actively working to educate others and break stereotypes. One nurse shared, "There are still many negative comments about mental health. For many, those who suffer are seen as a burden." These stories reflect not only the weight of stigma but also the courage and commitment of psychiatric nurses to advocate for understanding, compassion, and change.
For the conclusion, the study concludes that psychiatric nurses face intense emotional and behavioral demands, safety risks due to the unpredictable nature of their work, and rely heavily on therapeutic communication for healing. Despite these challenges, they find fulfillment in patient recovery, emotional rewards, and a strong sense of purpose. To maintain well-being, they use coping strategies like work-life balance, exercise, social support, and mindfulness with external systems such as peers, family, and organizational backing, fostering their resilience. However, societal stigma remains a major concern affecting both their professional identity and public attitudes towards mental health care. For the recommendation, healthcare administrators should strengthen emotional and psychological support for psychiatric nurses through access to mental health services, peer networks, proper staffing, and training in therapeutic communication and safety. Policymakers should craft policies that prioritize nurses' mental health alongside patient care, including workplace safety and sufficient staffing. Nurses are encouraged to pursue self-reflection, continuous learning, and advocacy for emotional well-being. Families should be educated to provide strong home support. Nursing schools should integrate mental health preparedness and empathy building into curricula. Future researchers should focus on stigma resilience and the application of caring models like Joyce Travel Bees to enhance nurse and patient outcomes.
Now for the utilization, the results of the study will be relayed to the selected psychiatric facilities and nursing academic institutions upon completion of the study as a basis for future planning, training, and support programs for psychiatric nurses, and be available to serve as basis for other institutions in establishing wellness and support systems tailored to psychiatric nurses, and made available to future researchers as foundational data for further studies on the lived experiences, needs, and challenges of mental health professionals in the country.
For the acknowledgement throughout this research journey, we would like to express our deepest gratitude to those who have supported us. To the 8 psychiatric nurse participants, our heartfelt thanks for sharing their time, insights, and unwavering dedication to their profession. To the University of St. LaSalle, our gratitude for the academic environment and institutional support that made this research possible. To our research advisor, Dr. Sheilla M. Trajera, our sincere appreciation for her expert guidance, critical feedback, and steadfast mentorship. To our families and friends, our deepest thanks for their constant encouragement, patience, and support throughout this journey. And to the God Almighty, our utmost gratitude for His grace, wisdom, and strength that guided us to the completion of this study.